This video is going to review pathway of blood flow through the heart. Now, a few things to get started is to understand abbreviations. So R equals right. L is going to equal left. A will refer to atrium, and V will be ventricles. Now, as we look at the anatomy of the heart, the two superior chambers, these are going to be our atrium, and the lower inferior chambers are going to be the ventricles. When we look at the dynamics of the tissues, the atrium don't have a lot of responsibility in actual pumping of blood flow, and we'll address that in a different video. So we look at the atrium, they tend to be very thin-walled. The musculature of the heart, known as the myocardium, is relatively thin. They will function, particularly if you're on your head or you got a lot of blood flow back to your heart. Once again, we'll talk about more in a different video. But their job is minor compared to the workload done by the ventricles. So when we look at the ventricles, you'll see a much thicker myocardium. The right side and left side do differ in their pathways of flow, so let's also differentiate that as well. When we look at the heart, the right atrium, right ventricle, left atrium, left ventricle. Make sure you remember that it's the patient's right and left versus yours. When we look at right side versus left side, they're going to pump to different circuits. You can see that when we look at the heart, there is a dividing line between the two. You can recognize that we made the color differences. When we look at the right side of the heart, this blue is indicative of deoxygenated blood flow. So when we look at the right side of the heart, it's going to pump to the pulmonary circuit. So when we look at the pulmonary circuit, this is going to carry deoxygenated blood flow to the lungs. So if we start in a more basic blood flow through the heart, blood returns from the body to the right atrium. Now this is deoxygenated blood. So it returns from the body to the right atrium, then it goes past the right atrium, past these valves. We'll talk about those in a bit, to the right ventricle. Then it goes from the right ventricle up where it's going to split and head to right and left lungs. And at that point, it's going to drop off CO2, pick up oxygen, and then we'll head back to the left atrium. From the left atrium, it goes to the left ventricle. Now, this blood right here, this is oxygenated, and this is indicative the red side of the heart, which is the left side. So when we look at this pathway, this is going to what's called the systemic circuit. The systemic circuit is heading out to the body, dropping off oxygen, picking up CO2. So the right side versus the left side of the heart, significantly different in their pathways. So just to review again, deoxygenated blood flow from the body heads to the right atrium, down to the right ventricle, goes up through a vessel where it travels to the right and left lungs, dropping off CO2, picking up oxygen, and heading back to the heart to the left atrium. Goes from the left atrium to the left ventricle, and then it heads out to the body, dropping off oxygen, picking up CO2, and then heads back to the right atrium. So this is a general overall pathway of blood flow through the heart. Once you have this down, the next video, a pathway through the blood flow of the heart, should make more sense.